Wow, we have a wide participation from everywhere, from the US, from Afghanistan, Sudan, Kenya, Myanmar, all over the place. So thank you so much for joining us again. From Syria, of course, from Lebanon. So we have some funds for Hassan. They will cheer you up. Yemen, Enas. Oh, Enas, so nice to have you. Enas is my mentee. Nice to have you. So Wealth Ethiopia, thank you so much for joining us today. So we will give one more minute before we start. Mali, welcome. A lot of familiar names, so thank you again for joining us. Nigeria, of course. Spain, Comoros, Nepal, Yemen, yes. Sierra Leone, yeah. Okay, so we will start. Thank you again for joining us. Today we will be talking about a very important topic, I'm sure for most of you, for all of you actually, because protecting the quality of health products is really essential to deliver high quality products to the last mile. And especially protecting the quality in every phase of the humanitarian response is key. Sometimes we think that protecting the quality, or the quality is just a matter of the manufacturers or the warehouses and so on, but the quality of the products needs to be protected at every phase of the humanitarian response. Everybody is involved. Everybody who is involved in the supply chain needs to protect the quality, needs to know how to do that. So today I'm joined by my colleague Annabella Sanchez, as usual, and together we will facilitate this session. So Annabella, can you please introduce yourself? You're on mute, Annabella.
Thank you, Nora. Welcome, everybody. So happy, as Nora said, to see very familiar names. So welcome, everybody. I am Annabella Sanchez. I live in Guatemala City, and I have been working for JSI supporting this capacity building program for a couple of last years. So very happy to be in this event again. So nice to see you all. Thank you, Nora.
Thank you, Annabella. And I'm Nora Quesada. I'm a senior technical advisor working at JSI. And I've been working for JSI for many, many years now. And I've been I've worked in international development and for several years in the fields of reproductive health, system strengthening, and supply chain capacity building in different continents, Asia, Africa, and Latin America, as well as in Eastern Europe. And I'm sending you greetings from Bogota, Colombia, South America. We're happy to have you with us today and look forward to a very participatory session. We also are honored to welcome Johnnie Amenyah and Hassan today. Thank you both for joining us today, and we are very excited to have you and look forward to hearing what you have to share with us. So Johnnie, can you please introduce yourself?
Yes, thank you, Annabella. Good morning, good afternoon, good evening, everybody who's joining us from around the world. My name is Johnnie Amenyah. I'm based in Washington, D.C. office of JSI, where I'm one of the senior technical advisors. I've worked in pharmacy systems and supply chains and system strengthening for all of my career, practically. So very happy to share what I know and to join this group discussing something that is really important for our work. So happy to be here.
Thank you, Johnny. And we also are honored by having Hassan Nasser with us today from IMC in Lebanon. So Hassan, please introduce yourself.
Hello, thank you, Nora, and thank you for inviting us to this technical discussion. As you mentioned, it's very important to the supply, especially for product health quality. So my name is Hassan Nasser. I work at IMC Lebanon. I am responsible for the mental health department in Lebanon. And I have over 7 years of experience at NGO, around 6 in the community pharmacy. So looking forward to this discussion.
Thank you, Hassan. So before we start with the content of the session, Annabella has some housekeeping recommendations as well as the introduction to the technical discussion. So back to you, Annabella.
Thank you, Nora. So as we get started, please continue introducing each other using the chat function. And during the Q&A at the end of the session, please only use the Q&A button that you see on the screen to post your questions. Your questions are very important for us, and we want to keep track of all of them, okay? And if you prefer to raise your hand and ask your question directly to the panelists, please also, you're welcome to do so. So first of all, we would like to thank the Bureau for Humanitarian Assistance of USAID. Thanks for their support. We continue offering you these education series meetings. And the objectives of this program includes developing curriculum, developing learning briefs to share knowledge with all of you and the humanitarian commodity logistics community. We also learn to share learning experiences and at the regional and at the global levels. And a very important objective also is to support partners to improve the policies and the practices in everything related to pharmaceuticals and supply chain management. We would like to remind you that this is part of the education series that Nora mentioned. And remember that if you attend 4 or more of these meetings, we're going to give you a certificate of attendance. So please watch on the news and our newsletters for the upcoming events. We first would like to overview the objectives of this meeting. And first, we're going to review with Hassan and Johnnie what are the roles, what are the actions that supply chain staff can do to protect the quality of health products. We will also share field experiences. Thanks to Johnnie and Hassan, we will talk about what specific actions you can take, and also learn from difficulties. We learned from you in the past part 1 webinar that there are always difficult conditions to protect the quality and to do quality assurance actions. So we're going to view some of them with Hassan and Johnnie's help and your help from the audience as well. So we would like to summarize briefly what are the actions that you do in terms of how to do quality assurance during the preparedness phase, during the acute phase, protracted, and post-crisis. And first, we would like to say that one of the very important actions that you can do during the preparedness phase is to review your standard operating procedures, to train staff, not only pharmacists, but warehouse managers, assistants, and even drivers that are responsible for transporting the products. During the acute phase, very important to keep an eye on the products, to do visual inspection. And also, if you have any other ideas, please write them in the chat. What are you doing in the middle of an earthquake, in the middle of a very deep crisis? what are you doing to protect the quality of the pharmaceuticals that you are delivering to people. Then during the protracted phase, when things are stabilizing a little bit, very important action is to review your essential medicines list to make sure that you have in your list those products that have been proved to be of high quality. And we're just giving one example, but as I said, please write in the chat if there is something else that you are doing. And then in the post-crisis phase, something very important is to keep in mind that the community, the users of the products are very important, and they can also give you feedback on the quality of the products. And last but not least, here are a few considerations because the conditions of your local environment really determine what are the focus of your quality assurance. For example, climate change, how to do the temperature controls, what resources do you need to have the equipment necessary, especially during the rainy season to protect the quality of vaccines and to maintain a very good cold chain. Then also zones with recurrent tornadoes and floods, what are you doing to keep them from humidity, unsecurity conditions? We have heard from you that sometimes during the transportation process, you face also challenges to protect the quality. And when there are scarce resources, are you able to have enough generators, solar panels, and very important warehouse insurance to protect the quality? And if you have other ideas, please write them in the chat as well. And so I would like only to say that we always like to say that quality assurance is a matter of life or death. You know, if there is a product that is not that does not have the efficacy, people can be harmed. So it is a very important activity. So now I will pass the floor back to Nora.
Thank you, Annabella. So before we start our conversation with Johnnie and Hassan, let me ask you a question, and you can, write the answer in the chat. What is your biggest challenge in protecting the quality of pharmaceuticals in the last mile? Just take a few seconds to think about that, and we would like to know what your biggest challenge is. We will keep an eye on the chat, so that you can give us a few food for thought, because the conversation that we will have with Johnnie and Hassan will address some of those challenges and issues that you face in the field, especially as Annabella was saying, when you are in the middle of a crisis. What's your biggest challenge to protect the quality of pharmaceuticals in the middle of a crisis? I think that's electricity. Temperature peaks, I would say, during transportation. The how to protect the quality while transporting the supplies. Okay, climate changes, road function safety, unanticipated delays and disruption due to security risks. Okay, temperature monitoring. During transportation, Hassan will talk about that. Transportation from central warehouse to the field. I think that that's key. Sometimes we have very good warehousing conditions at the central warehouse, but once you move your supplies from the central warehouse to the field, to small storage spaces, then you can jeopardize the quality of the products because you cannot keep the same conditions. Okay, so rodents. Okay, so it has to do with pest control. the transportation from suppliers, probably when you're talking about local suppliers that don't comply with the requirements that the pharmaceuticals need. Okay, so very thank you for sharing that, because this is exactly what we will be addressing during this conversation. So let's move on to the conversation with Johnnie and Hassan. And my first question is for Hassan. First of all, please give us a brief introduction of what IMC does in Lebanon, and please share with us two main challenges that you have, Hassan, to protect the quality of health products and other health supplies in Lebanon.
Thank you, Nora. First, let me introduce you to Lebanon. So it's a small country, relatively small, around 10,000 square kilometers. It's located in the Middle East, with the coastline toward the west. So as international, we are a global organization that have been providing emergency medical and health service in Lebanon since 2006. We partner with a local authority organization and other community to help deliver essential healthcare service, including primary health, mental health, psychosocial support, reproductive health, and also nutrition. These services are towards the vulnerable population, whether by conflict or displacement or any other disaster. Previously responding and still responding to the COVID-19 pandemic, and also to the ongoing Syrian crisis, and most recently the Beirut explosion in August 2020. So hopefully throughout this presentation, we will shed some light on some challenges and solutions mainly related to pharmaceutical supply chain, regarding the warehousing of the warehousing at the level of the centers, and to some extent procurement and transportation, which the chat also show some challenges there.
Yeah, next slide, please.
Yeah, so here we will discuss some of the IMC have taken place in regarding procurement and security of medication before coming to the warehouse or to the field. And also we'll talk about the storage issue, basically some the quality, the good storage practice, and also regarding the transportation, how we can secure a quality transportation using this at hand. So regarding the storage, I think one of the main challenges is we operate at two levels in Lebanon. One is a central level, which is related to the MOPH, Ministry of Public Health, and another which I will talk more directly is the storage warehouse at the primary healthcare center. And also we'll also discuss about transportation and the course of action that need to take place in order to protect the quality.
Okay, thank you so much, Hassan. And this is pretty much in sync with what people just mentioned, you know, having problems or challenges with keeping the quality of the products during transportation, how to monitor the quality when you get products from different suppliers, and also ensuring proper storage at the different levels of the supply chain, especially when you're talking about storing supplies in refugee camps and so on. So thank you so much for sharing that, Hassan, and we will talk about later during the presentation how you are addressing these challenges. Okay, so my next question goes to Johnnie. So Johnnie, as he said, he has been working in this field for many years now. So in your experience, Johnnie, what can supply chain management staff do to protect the quality of pharmaceuticals and health supplies? Because we usually talk about, as I said before, that quality control and quality assurance is a matter of suppliers and warehouse managers, but here we're talking about staff who work in supply chain management.
Thank you very much, Nora, and thank you all the participants also for joining us to discuss this very important issue today. When you asked me to talk about what supply chain managers can do, I thought that it's important to set the stage right and know where exactly we are in where we have some control and can take actions. So I decided to use this pharmaceutical value chain, which I'm sure many of you are aware of. Products developed and then manufactured and then procured and then put in the system all the way down to the users. And this framework is one that many of supply chain managers and supply chain workers know about. I wanted to make a distinction about where quality is established and then what you can actually do, what you have some control over to protect the quality. So when you take this value chain, you can see that all the things that happen before the products are selected are things that most supply chain officers or people that we're talking about in our day-to-day business do not have control over. And that phase is what establishes the quality of the products. But once you procure that product or select that product into your system, what you can do is to protect the quality throughout the lifespan of the product. There's nothing else you can do to improve the quality. So the quality as you receive, it's your duty and responsibility to maintain that quality for the rest of the life cycle of that product. Next slide. So with that in mind, some of the things are actions that you can take at the higher level. And at the higher level, I mean the central level, the main warehouse or the main procuring entity where the products actually enter your supply chain. At this point, what supply chain managers can do is to make sure that the product that they are receiving into their supply chain is really what they intended it to be, or is coming from the authentic source or the expensive source. This you can do by reviewing some of the shipping documents or the transportation documents that come with the product, the airway bill, etc., to make sure that the product is really what you're expecting to receive. At the high level, before you procure or receive products, you have to, in some countries, establish that the product is actually registered for use in the country. And if it's not registered, it has the appropriate waivers. Why is this important? It's important because products are registered based on where they are manufactured. And a lot of the things that go into establish that product, the authenticity of it. So you need to verify that. And then there are other things that you can do, looking at the manufacturing date and the manufacturing facility that the product is coming from. So if it's coming from company A's facility in a city that does not exist, then you probably know that there's a problem. And then you can examine the product packaging and the labeling. People who circulate poor quality products also have poor quality information and documentation going with it. So if you have a product that the name of the product is spelled wrongly or the manufacturer's logo is turned upside down, that raises alarm. Then other things you can do is to check the active ingredient name as written on the product, because all pharmaceuticals and medical supplies do have a scientific name that identify what they are. Next slide. And then there are other things that can be done at all levels, no matter where you are in the supply chain. When you open a package, you have to watch out for some of the physical attributes of the product. Is the color of the product uniform? Do you have a container in which some tablets are darker than the other? That raises concern. As supply chain officers, part of your role is to ensure that the product that is leaving your hands is good quality product. So that you protect the patients from receiving things that are not good. And then there are other physical attributes like the smell of the product. When you open a container of any medication or medical supplies, and it has a foul odor, an unnatural odor, then you know something could be wrong. Everywhere you are in the supply chain, it's very important to continually verify the trade name, the active ingredient name, the date of manufacture, the date of expiry as stated on the product, and any documentations that come with the product. These help you protect the quality of the product. Next slide. The other thing that as supply chain managers we need to do is to really use good pharmaceutical or good medical supply storage and distribution practices. Now, there are standardized good practices that are well documented. Many of us know about it, but they need to be appropriate to your location or to the setting that you are in. And so you have to take some time to adapt the good storage and distribution practices to your unique circumstances, and also to the face of any humanitarian situation that you are dealing with. You have to take active steps to avoid anything that will lead to high temperatures. Exposure to direct sunlight, for instance, is known to cause accelerated deterioration. High humidity in warehouses, high humidity and temperatures during transportation of your products could lead to diminishing quality of your product. And so one of the things that is very important to do is to train the personnel who handle the supplies to make sure that they know what to look out for. While not everybody will become an expert, at least they should know enough when they need to refer or consult somebody with superior knowledge and skills to validate the quality of the product before they are used. And this can be helped by developing specific and clear SOPs and work instructions as part of whatever quality management system that you have established. One thing that I think it's also important is to have a self-inspection policy and procedure that you carry out, that staff know that, for instance, when products come in, here's a checklist of the things that you need to look at. And periodically you go in and do a self-inspection to make sure that you are managing the quality of the products appropriately. I think these are some of the things that are very important that we can do to manage the quality of products or protect the quality of product when we receive them. And we'll talk some more about these maybe later on, and I'm looking forward to any discussions around these.
Thank you, Johnny. You provided very practical activities or actions that supply chain managers can take to ensure to protect the quality, because you were very clear about the value chain that you mentioned. I think it's very important how manufacturers establish the quality, but how supply chain managers can maintain and protect the quality of the products. So now Hassan, going back to Hassan and based on his the challenges that he mentioned, so can you share a good practice, or not just one, but some practices that you are implementing to protect the quality of health products, Hassan?
Yes, thank you. So there are a lot of practice. I don't think we can fit it in 1 hour. So what I will try to discuss or present today is the main step that as IMC in Lebanon have taken in order to assure a quality program. We still have a long way. For comprehensive quality assurance program. But however, some steps we have taken it to ensure the quality. So most important, the most important aspect is the procurement. We at IMC have a pre-qualification vendor. This can be applied whether to international procurement or procurement. So either necessary to have pre-qualification of vendors, this sure that the commodity entering through the supply chain system will be of good quality. So this is the first step in assuring a good quality program. Next to it, I will discuss about the storage, and here I will discuss what the condition mainly at the field level. So what at the field level, whether we as an organization are procuring such medication, or whether they are getting donated from independent. So our main mission is to provide an ongoing training to healthcare provider. This will also help them in having every information that is related to the quality assurance program. Mainly because so regarding the storage, because when the field level receive donation, whether us as an organization or other independent donor, they need to make check also about the quality, whether these are medication are counterfeit, whether the labeling is correct, whether the expiry matching the document. So as an organization, we are committed to have an ongoing, this is usually done by a field pharmacist and extend community, because we are trying to disseminate every knowledge related to the medication. So this is the storage. And one thing I could mention here is the pest control. So depending on the whereabout of the facility, so it could be in rural area. So we have to make sure that such issues are not which is some of the pest control. And lastly, regarding the transportation, so at IMC, at least here in Lebanon, we have like a double transportation method. So one of them is with the international supply, with the international procurement. The center are responsible for picking up the medication. Another aspect of what we do, whether because our organization doesn't have a necessary, so is to consider third-party logistic solution. This can be especially here in Lebanon, because most of our pre-qualified vendors are also distributing to the community pharmacy. So every transportation regulation, such as cold chain monitoring, installation of air conditioning in the trucks, and whether the condition, they know better than us. So this is one solution to make sure our transportation are up to a quality. And please. So here I will mention some good warehouse practice, and by warehousing, like I said, we are talking about the field level. So one of them is proper storage condition. So we need to make sure. So we need to make sure that there are proper condition, proper storage condition, a dry, well-lit area, installation of air conditioner for medicine, especially when it's too humid or too hot, above 30 degrees. So other also medical commodity, which is latex or contains some latex, it should be kept in the well-ventilated area and cooled area. Another thing we can at the field level is protect from filtration, like raise the level of the medication about 4 centimeters. Another aspect of this is the safety and security. So here we have a cabinet that is closed by that is locked by a key. This is to ensure unauthorized personnel to access this kind of medication. This kind of medication, since I work in the mental health department, So most of them are psychotropic and stand narcotic or controlled substance. So this is also make sure the price personnel can access these medication. And regarding the cold chain management, so in Lebanon, unfortunately, we have a mass shortage, outage of electricity. So as an organization, what we try to do is support centers by installing solar panel to each center where we suspect there are electricity. So this is one challenge. Can be fixed by a panel. Now, in the event that we don't have the capacity for a solar panel, I would say try to refer as many possible to other center where it's feasible to have a solar panel. Lastly, here in the good warehousing practice is the inventory management. So a key component of track the goods and of the medical product that enters the supply chain is to have inventory management. So here again in Lebanon, as an international medical ports, we are trying to do is to support also the PSC centers with the HIS system that is facilitated by the MOPH. So again, proper entry of data, expiry date number. This will help track the medication in case there was a mass recall for a product. So we will know in advance which kind of product went to which center. Next slide. So again, like I mentioned, quality assurance is an umbrella that encompasses a lot of different aspects. So the quality control, as I mentioned earlier, we try to strengthen the capacity of the field level. Similar to what Johnny mentioned, at the central level and at all level, we emphasize on the last mile in taking and holding the responsibility or sharing the knowledge with the center to basically have their own quality control, basically to have their own quality control. This can be done, like Johnny mentioned, expiry date, orders, or like bills that are not uniform, and so on. Another key aspect is also documentation and record keeping. Beside record keeping of inventory, we will also emphasize on documentation of the dispensing of medication to our beneficiary. And will say regarding the personal training. So this is a very tricky topic, because as an organ we rely mostly on the field, basically the centers' willingness and their participation in such training. Nevertheless, our organization is committed to ensure proper training is being done to the pharmacists at the center level. This can be done by our field pharmacist, our health officer, to some extent, direct communication with the beneficiary, and also to try to familiarize themselves with how they can detect such quality errors. And lastly, since this is a process, basically there will always be a continuous improvement. So yeah, so this is an ongoing process. It's not one stop. Basically, when the medication enters through the system, it's a cycle that we need to make sure that every step and every stage of it we are doing and also evaluating our quality assurance process.
And what you just said, that this is a continuous improvement, it's a cycle. It's very important to keep in mind that everybody has a role in protecting the quality of health products throughout the supply chain and at every phase of the humanitarian response as well. Something that very important that you said is when you don't have the conditions at certain places where you don't have solar panels and so on, that you try to keep the supplies in a center where it complies with those conditions. But inventory management is also important there, because you have to ensure that even though the supplies are at that center, not at the field level where you need the supplies at some point, you can still monitor the inventory, make sure that post that you were not able to have the supplies at because of the conditions were not adequate for that, you can still ensure that they will have the supplies eventually there, and you will be able to rotate the inventory as well.
Yeah, and this is also another aspect, the logistic management information system. So luckily our organization have what we call PIMS, Pharmaceutical and Information Management System. So so depending on the country, they can have an S, or our organization should have it at least.
Okay, great. Thank you so much, Hassan, again, for sharing that experience with us. So Johnnie, as a seasoned supply chain expert, can you share with us two or maybe three good practices that you have implemented throughout your career and in the different countries that you have worked in, and how to protect the quality of health products, and at which level of the supply chain you have experienced this, or you have implemented these practices?
Thank you, Nora. And great information shared with us just now by Hassan in terms of what things can be done. When you asked me to maybe share two, maybe three, I heard two is too small, three might not even count it, and trying to see which interventions or which examples have the more broader application. So these are what I chose three things to share of how one can improve or manage the quality of products properly. And the first one is to incorporate a quality check into the routine fiscal inventory activities that you do. I know that many supply chain systems have a fiscal inventory or stock taking events that they do periodically, maybe at the end of every month or at the end of every quarter or at the end of every year. Now, most of these are to count the inventory and to reconcile what is available with what the records say. But you can incorporate quality check activities into that physical, because that is one time that you take time to go through your warehouse or your store and actually check everything that you have. So a good example practice is to develop a checklist or some data sheet that allows you to assess the quality dimensions of the products when you inspect them physically. Your checklist should include things like verifying the color, where color can be used as a dimension, verifying the integrity of boxes and whether things are broken or squashed, making sure that there is no untoward order around the things. So when you're doing your physical inventory, that is one opportunity that you have to actually check the quality also. While the quality is not one of the physical inventory records that you traditionally keep, it gives you an opportunity to identify these things and to take action. The other thing that you can also do is second one is to do a self-inspection. self-inspection, we know that from time to time you would have a superior or somebody from a higher level coming to check on things to see whether as part of any supportive supervision or routine supervision visits. But at each level of the system, you, the operator, you, the supply chain manager there, should have a self-inspection that you do periodically. Create a form that you use to check things. You are not only going to check the products that are in the warehouse, also check the warehouse or the store, the physical conditions of the store. These are looking for things like damage to the building. Is the roof leaking? Is there something wrong with it? Lighting in the place? Are shelves tilted, about to collapse and crumble on other things? Check for ventilation. Has the AC system been serviced recently? And make sure that you do these self-inspection things. That also a time that you can go into the warehouse or your store and actually look for issues regarding pests or other rodents that may infest your store. Because when you are busy just removing inventory, shipping things out and distributing things, you probably will not have enough time to notice the evidence of rodent or pest infestation at that time. So set out some time to actually physically inspect the building and make sure that everything is okay. And indeed, in the interest of time, Nora, I will not talk about the third one, but we can address those when we come to question and answers. Thank you.
Thank you, Johnny. Thanks so much for sharing these good practices. And going back to Hassan, because we also want to hear about, from the field perspective, some takeaway messages for organizations who are listening to us today, Hassan. What would be those takeaway messages for them to protect and monitor the quality of supplies, or especially pharmaceuticals, in emergency settings? Because you know, the conditions are always very difficult, and so it's important to hear from your experience. What would be those messages that you would like to share with the participants today?
Thank you. So one of the most important aspects in the crisis is the preparedness. However, since the crisis, it's not too much. We can't prepare in advance, but we need to take some measures during the crisis. So one of the key components in the crisis to prioritize and ensure proper transportation. This is basically because, like we mentioned earlier, there are a few key steps we need to make sure before reaching a crisis. So one of them is contracting with the supplier via third-party logistic, and you make sure that these trucks are equipped with refrigerated truck, storage container in the event. So this is one aspect in preparing for a crisis, is to prioritize and check whether this facility have enough medication to hold it for like 1 month or 2 months, depending on the time lead. So this is one crucial aspect of it. Secondly, like I mentioned earlier, because during a crisis there will be a flood of donation to the community affected. So one of the key aspects that we can, this is not mainly related to the field, but basically for the community, is to share as much information about the medication and the quality to the community, because they are the intended recipient for such a commodity, whether they can pick it up from the field level or not. Another aspect, sharing of information on product. So this is also a key aspect. And lastly, education of healthcare provider and patient. This is mainly because during a crisis, during a crisis, the healthcare provider should know in advance what kind of commodity they are receiving, what kind of information they are want to share. So as a pharmacist and basically the community health, community health, try to educate as much possible before the crisis. So when the crisis come in, so they are prepared for it. So
yeah, thank you, Hassan. And what you just said, you know, even educating the healthcare providers and the patients is very important to protect the quality, because once the products are in the hands of the population, probably if they don't know how to handle the product, if they have to keep it for several days, in their houses or the camps, it's important that they also understand how to protect the quality of the products that they have. So thank you so much for sharing that. So we will move to the Q&A from the audience now. And we have one question for you, Hassan. How does IMC ensure product quality during procurement? That's something that Johnnie talked about during the value chain. And how do you assess the quality of the distributors and the suppliers?
Thank you. So regarding this, like I mentioned, we use a pre-qualified system. So we can make sure that every supplier that will give us medication or procure for us medication, it's a pre-qualified vendor. And our pre-qualified vendor here at IMC so involve a lot of personnel from different departments. I'm talking about finance, compliance, logistic, medical doctors, and pharmacists. So it's a whole process for pre-qualification in order to make sure that whatever comes from that particular supplier is of good quality. And regarding the assessing of quality of distributor and supplier, like I mentioned, here at least in Lebanon, we contract mainly with the pharmaceutical vendors. So we can do our assessment, and most of important thing, we have in our back the Ministry of Public Health. So we have double eyes on that distribution.
Okay, thank you, Hassan. Johnnie, you know, there are, as you know, especially in Africa, I think that's a huge concern. The fact that there are a lot of fake substandard products or counterfeit products. And in the chat, people have been saying, you know, that how to really address that, how to avoid that, and how to really stop that, because that could harms the health of the population. So in your experience, how can countries deal with that? How can organizations deal with that, especially in humanitarian settings where you need the supplies right away and there's no way you can wait for having the right pharmaceuticals for the population?
No, that's a very important question, Nora. Poor and substandard quality products hurt you in several places. Imagine being in a certain humanitarian environment and then being ill and then getting a substandard product which will not treat the disease and may cause other challenges or products. And when I use drugs, it's uses generically to include both medical supplies and pharmaceuticals. So, but we know that the issue of substandard products, it's a global challenge. So how are some of the things you can do? One of those is to, like Hassan said, only source products from approved pre-qualified suppliers. Now, pre-qualified suppliers allow you to do a little bit analysis of the caliber of the supplier even before you procure from them. So that's a very important dimension. The other way is to involve the regulatory arm where it exists in the process, certifying that products are registered, that the product is authentic, and then also sharing the information about that. If you find in your system some product that you think is not authentic, refer it to the regulator, have them test it, have them sample it. I know that many people, I saw a question about what if the product is not registered in the country. There is always a process for verifying through the regulatory system, the National Drug Regulatory or Medicines Regulatory Agency, to play a role in supporting the quality management. I think that it's something that we have to keep an eye on all the time, be alert all the time, that fake substandard products could enter the system, and to guard against it.
Thank you, Johnny. Very, very important what you just mentioned. So Macarena is asking Hassan, how does IMC manage temperature excursions on cold chain during storage? I think you mentioned a very good example the other day. We talked about this topic, Hassan.
What's the meaning of exclusion?
Yeah.
So
how does IMC manage? Yes, go ahead.
No, I'm just thinking about the word excursion.
Yeah, temperature peaks, I imagine.
Okay.
If the variability in the temperatures. Yes.
Yes. So regarding this, so as beside the transportation and well-ventilated air conditioning in the truck, so we do a monitoring of temperature throughout the process. So this is why we can check from the start and towards the end whether there are too many fluctuations in the temperature. So if they are not up to the standard, for like example, like for example insulin. So if we have some sort of fluctuation in the degrees, we need to make sure this product is not of quality. So we manage like at least whether if we are not sourcing through third-party logistic, we can do only check monitoring check. And luckily for us in Lebanon, we don't have too much distance to travel in Lebanon. So the fluctuation is minimal. In Lebanon, we don't have that main challenge here because our climate is relatively cold, not too hot. So yeah.
Okay, that's an advantage that you have. The geographic conditions are very important. You're very lucky, Hassan, to have those
at least we have a climate
there. Yes, and but there's a very important question here, I think, interesting question. And what is the importance of documentation during an emergency response?
So it's a crucial component. It's for the traceability of the product. So during emergency response, we can have like counterfeit medication, not of good quality medication. We need to keep track of those medication before arriving to the field. So it's an important the documentation during emergency response, because mainly it's provide a traceability of the product and to some extent accountability of the accountability.
Okay, great, thank you. And also what you said, the traceability is very important, especially when you're talking about recalls, right? When you have to recall product. I think that, yes, go ahead.
Especially when you have a pharmacovigilance system in the country. So
exactly.
So as an organization, we are playing a role in it also.
Okay, thank you. And I think Macarena raised her hand. Would you like to speak up, Macarena? Okay, Daniel, okay.
Yes.
Can you open up her
Macarena
mic?
is unmuted. Yes.
Yeah,
She has to unmute herself though on her side.
okay. Okay, great. Okay, so we're at time, but before we leave, we would like to leave you with some ideas for action. And we will respond those questions that we were not able to respond today by email as we usually do. So some ideas for action in procurement, review product specifications like Johnnie and Hassan mentioned, very important to have the technical specifications of the product and review those once you procure. Inventory control, the lot numbers and the lot to register the lot numbers is very important and keep track of those, especially when recalls must be executed in warehousing and transportation. Reinforce quality assurance and monitoring when loading trucks, when distributing to lower levels, when using third-party logistics distributors, because they have to comply with all the conditions that the products require. Also, when dispensing pharmaceuticals and health supplies, instruct users on how to protect the quality, especially when they are dispensed to patients. And monitoring evaluation, conduct end-to-end routine monitoring and collect information from the patients, from the health facilities for continuous improvement, as Hassan mentioned. Remember that we have a list of resources here for you to look at, and especially resources 1 and 2, which would be very important for you to look at because they talk about quality assurance specifically and what supply chain managers can do to protect the quality of products. We also have more resources in the next slide. And number 5 is very important because it talks about the quality assurance or temperature control for cold chain for vaccines. So we invite you to look at these resources. And if you have more resources that are not listed here or that are not in the HCL library, please share them with us and we will share them with the community of practice. So we truly thank you for joining us today to this webinar and a technical discussion. We hope it was very useful for all of you, and we will get back to you with the responses to the question that we were not able to cover today. And we thank Johnnie and Hassan for sharing your experience, your good practices, your recommendations to improve and to continue protecting the quality of health products in humanitarian settings. So thank you so much, Johnnie, Hassan, Annabella, Barbara, Daniel, and thank you all for joining us today, and see you next time, okay?
Thank
Yes.
you.
Have a good
Take
day.
care, everybody.
Good evening.
Bye-bye.